Good morning, everyone. Hello. Good morning, everybody. This is Dr. Paul Biluan again, back for another free live class hosted by Aspire, RN, and Kinetics College. We are live right now on the Facebook pages of Aspire, RN, and Kinetics College as well. So let me just share this link real quick and make sure that I've shared it appropriately. Um, and yes, we did. All right. So if you guys are here right now and you have friends that are waiting to come in, please tag them on the posts on our page, on our pages, so they can come in and join our class right now. Okay. And again, this is Dr. Paul Biluan, and we are doing free live classes together with Kinetics College and our other partner providers every Monday. So Aspire RN is slated to teach every first and third Monday of the month. This is the third Monday of the month of June, and we'll be back in the first Monday of July. For more information about Kinetics College, please visit Kinetics USA Facebook page for the schedule, as we are also hosting other providers for English exam. Aspire RN is the partner NCLEX prep course provider by the Kinetics USA nursing recruitment agency. Aspire RN is in the business of providing NCLEX review classes online or virtually, and you can join us anytime you want. All right. And while we are waiting for others to onboard, today we'll be talking about safety precautions, and which is actually a vital component of the NCLEX-RN. NCLEX-RN, for those who are not aware, is the licensure examination required for you to practice here in the United States of America. And by the way, I'm streaming live from Houston, Texas. It's about 7:02 a.m. right now on my clock. And thank you for everybody who are here and has joined us for this class. While waiting for the others, let us hold on 1 second. I think I have misplaced my slide. Anyway, let's wait for the others. While we are waiting for the others, can you guys please type in your location and your time currently where you are located right now? Last time when I taught 2 weeks ago, we were joined by many students from different continents of the world. And I can see your comments from my live streaming app right now. Um, so we'll read those comments as it comes in. For those who are barely coming in, thank you for joining. This is the Kinetics College and Aspire RN hosting a free live class today for the NCLEX. And Kinetics USA is in the business of recruiting nurses for the United States, and they offer a lot of different programs, including scholarships for NCLEX exam. So if you are looking forward into getting a scholarship for NCLEX review class because you could not afford it, Kinetics USA is financing that for you for free. If you are interested, we'll flash the link of where you can apply here on your screen right now, and we'll post it on the comments. So we're offering scholarship. Aspire RN is the partner NCLEX provider or NCLEX review class provider for Kinetics USA. The link is cusa.link/aspire-rn. cusa.link/aspire-rn. Please make sure to tag your friends in this live stream and in the comments section so they can see the link of where to apply for the scholarship program for the NCLEX review class. All right. And we have Philippines, people from Philippines. It's 8 p.m. there right now. We have people from, let's see, Riyadh, that's in Saudi Arabia. It's 3 o'clock p.m. right now. We have people from the United Arab Emirates. It's 4 p.m. there right now. Abu Dhabi, United Arab Emirates, of course. 4 p.m. We have people from Jamaica. What time is it from Jamaica right now? I'm reading off of the comments. And more people from Saudi Arabia. Oman is 4 p.m. right now. Kuwait is 3 p.m. Egypt is 2 p.m. And more people from the Philippines and um, and more people again from Saudi Arabia and the Middle East. So keep those comments coming. I want to see where you guys are located. We're about to start in a bit. I'm just letting people to come in and join our class because we have barely shared the link. And thank you for joining us today. I'm monitoring my Facebook as well in case you guys have a message. And more people from Philippines. We also have a student from Somal. What time is it right now in Somal? Can you share your local time? Again, for those who are interested for an NCLEX review class scholarship program, Kinetics USA has partnered with Aspire RN to do this. We're gonna flash the link right now at the bottom. It's cusa.link/AspireRN. I would encourage everybody who has not tried or even think about taking the NCLEX and coming to the USA. You might be somewhere in the world and you're not sure if you want to do this, just try it out. We do qualifying exams. Our recruiters are going to speak to you, check if you meet the criteria. They're going to be talking to you of what's the process of getting the scholarship by going to this link on your screen right now. And we're going to post this in the comments as well. We have students from South Africa, and it's 2 p.m. there right now. And more people from the Philippines. And it's 5 o'clock p.m. in Somel. So we're all over the world right now. We have people from the Middle East, from Asia, and from Africa. I haven't seen people from Europe yet. Last time we had people from Europe as well. And so more people are coming in. Please tag your friends, and we're about to start soon. Okay. So anyway, if you've missed the class, this will be recorded, and you can still catch this class later. Can you guys do me a favor for everybody who's online? Can you please click the share button in your Facebook screen right now under this video? There's an arrow facing to the right. It's the share button. Can you please share these to your walls or to your Facebook groups? That way people can join us and see this class. We have Sherilyn Kimpo right here, one of our students from Aspire RN. I believe Sherilyn already passed her NCLEX exam, right? And please share this on your Facebook pages or walls. So that way more people can see our live class. And even then, if they miss the live class, they can see the recordings later after this class has concluded. So for today, what are we expecting? We are expecting a small class about safety precautions, which is a vital NCLEX component. I'll talk about that later. And after this will be a few questions to test your knowledge. All right. So I would want for you to really stay with me until the end of the lecture. The lecture is probably going to take about 15 to 20 minutes. And then the questions will take about similar amount of time, 15 to 20 minutes. And then I'll explain to you the answer. All right. Please share your this Facebook live show to your walls so people can see it. Um, Thank you, Sherilyn Kimpo. If you have a time, please share your experience to our students right here so they can see what Aspire RN does for their students. All right, and we're gonna be running up. We're gonna be running through the concepts, and then again, we're gonna have few questions and answers towards the end. If you guys are ready, can you please type yes, I can in the comments? Yes, I can. If you are ready, please type yes, I can on the comments just to see if you guys are able to understand what I'm saying right now. If you're streaming um, bandwidth or your internet is working fine, and to tell me that you guys are ready to listen to the class. All right, and more people are coming in. And we are now 12 minutes into the live show, and we are seeing a lot of people saying, Yes, I can. All right, without further ado, let's talk about safety precaution. This is again Dr. Paul, your NCLEX expert from Aspire RN and Kinetics College. Again, for those who are just barely coming in, we are doing the classes every Monday. For more information, please follow Kinetics USA Facebook page for the schedule. Aspire RN hosts free classes every first and third Monday, so you'll be seeing a lot of us every month. And in a way, we're doing this not only to you know to do a live stream in Facebook, but it's also our way to um, pay it forward for people who could not afford review programs. All right, and if you are this person that you could not afford NCLEX review program and NCLEX process, again, Kinetics USA is providing scholarship. You will see the link flashed on your screen at the bottom right now, and you can also see this in the comments. It's cusa.link/aspirern. If you are interested, please fill out the application form. Very short application form. You could probably finish it within 5 minutes. And after that, that's it. You're going to wait for the recruiter to reach out to you. In Kinetics USA and Aspire RN will provide scholarship to you. All right. And let's get started. Safety concepts that we're going to be talking about today is about 12% of your entire NCLEX examination. On your screen right now is the current NCLEX-RN test plan valid until April or March 31, 2023. On April 1, 2023, the plan can change because the NCLEX will be updated on that date. And about 12% of your whole NCLEX exam will be safe about safety and infection control. In my last free class 2 weeks ago, I discussed about infection control. If you have missed this, you have three ways to do that. You can either go to Aspire RN Facebook page, go to Kinetics USA Facebook page, or go to my Facebook page at Dr. Nurse Paul, and you can see the links in there of my previous video and my previous classes as well. So last time we discussed infection control, and today we're going to talk about a little about safety precautions. Please tag your friends and share this show to your wall so more people could see it and we can reach more people through this live class. All right. And now let's talk about preventing falls. Very important. One of the big things here in the United States when you practice here, one of the big things that JCO is looking at, JCO is the Joint Commission of Associations of Hospitals and Organization. This is the accrediting body for hospitals. If you are JCO certified, your hospital provides quality care, excellent care, and safe care. All right. So safety is very important. In your practice as a nurse. That's why it's one of the vital components of your client needs for the NCLEX-RN, right? And one of the big things that we need to talk about is preventing falls. There are many patients that are at risk for falls. We're going to particularly focus on confused patients, on elderly patients, and young kids or children, right? Now, for preventing falls, you will of course alert the staff. All right, what are the indicators for falls? Is this patient taking a sedating medication? All right, and then of course we put armbands. We're going to talk about that later. Socks and door signs. We talk about the 5 P's of preventing falls. All right, remember the 5 P's. All right, first one is pain. So when you're doing hourly round, this is a Jacob protocol. And when you start working here, you're gonna do your orientation. They're gonna be discussing this to you. Is first thing that you need to remember is pain when doing your hourly rounds when preventing falls. Check for pain level of the patient. Most commonly, patients that are in pain are uncomfortable. So if you're not there inside a room or you didn't hear them call, they are more likely to try to stand up, get off the bed. If they're confused, it's going to make them even more confused. And pain, increasing pain, can also increase the risk for fall. So we have to make sure that the pain is managed, of course, with various methods, whether it's non pharmacologic or pharmacologic. So make sure you're on top of it. That's the first thing to consider, one of the 5 P's. The second P is personal needs. All right. Provide the patient the ability to eliminate. All right. Can they walk to the bathroom or the restroom? Do they need assistance when they do that, or can they, partially need assistance, but they already have their mobility devices like a walker, or maybe they're bed bound and they could not go to the bathroom. Well, don't let them go to the bathroom. Put whatever elimination devices that we can use. We can use a bedpan, we can use a pure wick, or a catheter if that's indicated and ordered by the physician or the provider. If you do not attend to the elimination need and patients have full bladder, they are more likely to try to stand up and increase the risk for fall again. Also consider their need for hydration. Are they drinking enough water? Are they hydrated? Patients that are dehydrated are more likely thirsty and would try to reach or stand to get their drink, and that will increase the risk for fall. Again, this is dependent on the diet orders. If they're NPO, we need to explain that particularly to the patient. Nutrition, do they need to eat? Do they have orders to eat? Are we feeding them on time? Or are we attending to their nutritional needs? Patients that are hungry are more likely to stand up again and try to reach for food, and that will increase the risk for fall. And the last one are the belongings. All right, are the patient belongings close to the patient? Are they able to reach it? All right. So make sure that the belongings are close to the patient's bed. That way they don't have to stand up or try to reach it, which can increase the risk for fall. Again, the second P for preventing falls is personal needs. Attend to the personal needs. The third P is position. All right. Is the patient comfortable? All right. If the patient's comfortable, they're going to stay in bed. If they're uncomfortable because the bed is probably positioned incorrectly, or they probably couldn't breathe because of the position, they might need to be an eye fowlers, or probably the bed is uncomfortable for whatever reason, mechanical reasons, or it's not working properly. They are more likely, again, to stand up and transfer to the chair to the side of the bed, which again can increase the risk for fall. We're trying to eliminate every risk for fall, so make sure your patients are comfortable, especially when you're doing your hourly rounding, right? And make sure that the bed is also in the lowest bed position. If they have risk for falls, put the bed in lowest bed position. That way, just in case the patient falls, at least it's in the lowest bed position, and it will minimize the risk for injuries, right? But then again, if the patient sustain an injury during a fall, you got to know that this can be a malpractice case or negligence case on your part. So be very careful. The fourth P is placement. All right. When we place a patient with fall risk, we make sure that we put call lights or buttons. All right. So that way they can call us if they need. Just press the button or the light. Put them close to the nurse's station as well as much as possible. It's not always possible because a lot of patients might be at risk for fall at the same time, and there might not be enough rooms close to the nurse station. But make sure you have call lights, call bells for these patients. And the last one is for preventing falls. I provided 4S, all right? Signs. Put a sign on the door outside the room, so that way we're communicating to every healthcare provider that this patient inside this room is at risk for fall. In the hospital where I worked at, we used various different stuff. All right, there could be risk for fall words or fall cards, is what we call it. In other hospital that I worked at, is a star, yellow star. So there's a yellow card with a star, falling star on it, and we put it on the wall. That gives us a signal, or it tells us that if the room has this sign outside, the patient is at risk for fall. So make sure that we are using the proper signs per hospital policy to communicate to everybody that the patient's at risk for fall. And we also have socks, the non-slip socks. So these are socks with like rubberized sole. Um, that prevents slipping. So make sure that if the patient is at risk for fall, put them on socks. That way, if they try to stand up, it will decrease the risk for falls. So in the hospital that I worked at, we use yellow socks because that indicates to the healthcare providers that the yellow socks is a patient that is at risk for fall. Some other hospitals use red socks. Follow your hospital policy, but definitely there's socks to prevent slips, and that could decrease the risk for fall. Sounds, all right. Can we hear the bells, the alarm? All right. If we can hear them, we're more likely to be able to help them. Sometimes the bells are not working. Sometimes the call bells are plugged out from the wall and they're not working. Please, before going out of the patient's room, especially if they're at risk for fall, press the bell yourself and see if it is working. And then, of course, secure. What are we needing to secure? The bed, of course, the brakes in the bed, and the locks. All right. There's also bed alarms. I forgot to say this on the sound part. There's also bed alarms. Some beds, not everything, but I've seen a lot of them being used currently. I don't work in the floor, I work in the ER. We don't have bed alarms in our beds, and our beds are smaller. But beds have alarms, the regular hospital beds, the big ones, they have alarms. When the patient get off the bed, they will start ringing. So make sure all of these protective features of your room, of what is provided by your hospital, are being correctly used. All right. So make sure you address all the 5 P's to prevent falls. All right. So that's it for falls, and we're gonna continue to other topics. Please continue tagging your friends to make sure that we can reach them out. I know it's a little late in some parts of the world. Um, and we're gonna get to that. If you have questions, pop it in the comments. What's good with the app that we're using is we're able to see the comments real time. I'm not on Facebook right now. I'm on the streaming app, but we can see the comments real time on all our pages. All right, where we're conducting the live show. So please, if you have questions, put it in the comments box. Or if you have comments that you want me to read, all right? If we have time, we can read that out for the class, all right? And now, for restraints, let's talk about restraints. We have two types, the physical or chemical. We have to know this. Legal issues can arise from the use of restraints because that's false imprisonment, all right? We only use physical or chemical restraints as a last resort, all right? If we have exhausted other um, efforts to prevent falls or risk for safety problems, we use restraints as a last resort. Both physical and chemical restraints would require a doctor's order, and we're going to talk about it in a bit. All right. It says there in second bullet, we only use it for therapeutic needs or to ensure the safety of the patient. It is not used for the convenience of the nurse or the healthcare provider, all right? It is used to prevent safety problems for the patient, all right? It's not used because, oh, this patient's a little agitated or does not want to follow my instruction. I'm going to restrain him. You cannot do that. They can legally sue you in court, and that could make you lose your license. Be very careful. And of course, when we do restraints, we use the least restrictive first. Particularly, it's if it's a physical restraint, then we use one hand restraint first, or two hand restraint, or 4 point. So of course, 4 point is the last resort because that's very restrictive. Monitor the patient. Restraints can also be very risky. I've seen patients, getting more injuries from restraints, trying to pull themselves and dislocating their shoulders, or causing more fractures, or committing suicide through the restraints. Be very careful about that and document the use of restraints per hospital policy. Documentation very clearly. This is a legal document. If you didn't document, it didn't happen. If you put the patient on restraint and it's not in your document, and the court finds out about it, and the patient died or had an injury because of the restraint, you can definitely lose your license, the license that you've worked hard for. So be very careful, and get the doctor's order. Or doctor's order is usually valid for 24 hours, which means after 24 hours they have to renew the order if there's still a need for restraint. All right. Without doctor's order or provider's order, it could be a nurse practitioner or physician assistant. Without their order, you are not legally protected. All right. So they will only order that if they think it's needed. If you think the patient needs it, advocate for your patient and explain to the doctor or the provider the situation, and then they can put the order in. But again, no order means you cannot do it, right? And it has to be renewed every 24 hours, particularly the physical restraints. When you're applying physical restraints, apply it for 2 hours maximum, all right? After that, release for 15 to 30 minutes, check for circulation, all right? And then put it back again after 30 minutes if there is a need. And in one of the hospitals that I worked at, I used to be travel nursing. So I've worked in multiple hospitals over the last few years that I was here in the United States. Um, we actually, most of the hospital that I worked at in the ER, I worked as an ER nurse. Um, we do every 15-minute documentation for vascularity or neurovascular checks and vital signs if we are using restraint for violent patients. For violent patients, meaning they're behavioral patients, they're patients with mental issues or disorders, or patients at risk for hurting themselves or the others. All right, so every 15 minutes. So that's why you always have to check if there's a need for it. Maybe the patient don't need it no more, or maybe there's still a need. You gotta document it per hospital policy, but you definitely need to remove it every 30 minutes. I mean, every 2 hours. Check for 30 minutes. Make sure that there's adequate circulation and you're not causing injury, and then you can reapply it again. Check neurovascular status. Can the patient feel? Is it numb? Is it cool? Is there capillary refill? Is it less than 3 seconds? Is the color of the hand pink or is it pale? And of course, capillary refill every 15 to 30 minutes, right? I've already mentioned that. So those are the stuff that you need to remember for restraints. Any questions so far? Nope. We're going to go further to more safety precautions. Remember, we have questions that will come up in a little bit. I have a few more slides to show. Now, let's talk about fire safety, one of the most common NCLEX questions. By the way, I handpicked those stuff that are commonly coming out in the NCLEX. You're lucky because this is only a 1 hour class, but I've picked the most important concepts. I definitely could not teach the whole concept. Safety and infection control takes about 4 hours in my regular class in Aspire RN. But because I only have 1 hour to do kinetics college, I've picked the things that are most commonly coming out in your NCLEX. So, which is very, we skip the part that we don't need to talk about, kind of like that. Now, there are different types of fire extinguisher for fire safety. There's Type A, Type B, Type C, Type D, Type K. All of the hospitals are required to have fire extinguishers. Most buildings require fire extinguishers, and apartment complexes or your residences, right? The usual that we see is Type A. Type A, the mnemonic is A for ash. So it's for ordinary items, right? Letter B, if you see type B on your fire extinguisher, it's the mnemonic is barrel. So all flammable liquids or gases like spray cans, we need type B fire extinguishers, all right? For type C, the mnemonic is current, which means electrical current, all right? It's for electrical equipment. If the fire is coming from electrical equipment and there's electricity, we need to use type C fire extinguisher, all right? And letter D, we use the mnemonic dynamite for combustible metals. So any combustible metals that can, of course, explode, we use type D. Definitely type A, fire extinguisher could not extinguish the fire from combustible materials. It should be type D. And the last one is type K. If it's type K, remember the word K, kitchen. So remember oils or fats. So if the fire is coming from oils, we need to use fire extinguishers that can work for type or fire extinguishers that are type K. So again, ash, B, barrel, C, current, D, dynamite explosives, or K, kitchen oils and fats. All right. More people are coming in. If you have just joined our class, can you please put your location on the comment section and your local time so I can give you a shout out? We have a lot of people coming from the Philippines and the African region. All right. and I'm sorry, Middle East, UAE, Saudi Arabia, Kuwait, and Oman. We have one student who just joined from Hong Kong, and it's 8:11 p.m. there. I believe Hong Kong and Philippines are in the same time zone, but Hong Kong is in China. So, all right, so we're seeing more students. We have another student that is joining from UK. Now I see people from from the European region. It's 1:30 p.m. right now in UK. I have another student right here that is from Texas. Katy, Texas. We are neighbors. I'm from Houston and you're just about 20 to 30 minutes away from me. And we have more people from the Philippines, different regions of the Philippines. And again, UAE student from Abu Dhabi. Somebody put up a flag. I'm not really good with flags, especially if it's a very tiny icon. Please put your location so I can um, mention that online. We have more patients. I'm sorry, students coming from the Philippines. One student is from Indiana, United States. It's 8:35 a.m. and more people from the Middle East as well. We have one student from Sydney, and it's 10:30 p.m. right now. Right, I'm over here located in Houston, Texas, and right now it's about 7:30 a.m. in my time. All right, Dublin, Ireland. We also have a student from Dublin, Ireland. We also have a student from Nigeria. It's 1:30 p.m. right now. So we're all over the world right now. We're streaming live from the African continent, the European continent, and the Asian continent. All right. Guyana. We also have a student from Guyana. So we're covering a lot of countries today. Thank you for representing your location right now. Um, Now let's go back to the lecture. When there's fire, this is basic knowledge. Remember the code RACE, RACE. Letter R is rescue the patients, try to evacuate the patients from their rooms. Letter A, activate the alarm or pull the tab from the alarm system. Letter C, try to contain or confine the fire, close the doors, close the windows to prevent fire from spreading out to adjacent rooms. And letter E, extinguish or evacuate. All right. If you have access to extinguisher, try to use it. But if it's a massive fire, of course, let the firemen do it. Evacuate yourself and your patients. All right. So remember the word race, rescue patients, activate alarm, confine the fire, extinguish, and evacuate. Thank you guys for those who are just coming in. United Kingdom, Florida. Thank you guys. And more people from the Philippines again, and Hong Kong, and Riyadh. Thank you guys for joining. Please kindly help me by sharing this live show to your walls or to your Facebook pages that you're a member of so more people can watch this free live class. I believe this is very helpful for those people that are going to be taking their NCLEX soon or maybe taking their NCLEX in the future. All right. And then again, I'm going to mention again the scholarship programs later. I already mentioned it at the beginning, but I'll mention it again in a bit. Now, to use the fire extinguisher, I've used pictures as well for those visual learners. But remember the mnemonic PASS, all right? PASS, letter P is pull the pin, letter A, aim at the base of the fire, all right? So there's a pin at the top of your fire extinguisher by the handle. Pull that out because that's a lock, safety lock. Aim at the base of the fire. The nozzle is aimed to the base of the fire and squeeze the lever and sweep from side to side. I have students from my former students from when I was still teaching in the Philippines, but I'm based here now in the United States and I'm currently affiliated with Aspire RN, which is a company that I put up to help students pass their NCLEX and connect them to recruiters. In this case, we are affiliated with Kinetics USA in hiring and recruiting a lot of nurses. There are hundreds of students that we are that have joined Aspire RN right now through the Kinetic Scholarship Program. So very, very vital and helpful for everyone who cannot afford the NCLEX. I'm going to mention the link again later. It's in the comment section, but we're going to talk about that later. So remember, pass when you are doing when you are using the fire extinguisher. That's basic knowledge. But again, um, Just remember this mnemonic, okay? So now for electrical safety, I remember this being a select all that apply questions for multiple students in the past, all right? For the cords, these are the hazards. Of course, don't use them if they're frayed, if they're tangled, if there's a tape, if there's extension cords too many. Extension cords have voltage too. If you overload that, it's gonna start a fire. All right. Electrical equipment ungrounded. Here in the States, we use a three-pronged um what's this plugs, right? The third prong is the ground, which means if there's like an electrical current that's free and moving somewhere else, it's gonna direct it to the ground, and it's a ground plug, right? And it directs it to the ground where the electric can go out. Electric will come in, but it also needs somewhere to go out. Otherwise, it's just gonna keep moving to conductors. So we need to use that ground. I know some other parts, like in the Philippines, we don't have that ground, but other parts of the world have that ground. All right. So it's a three-pronged plug. We need to use that. You do not take off the ground. If you see an equipment that doesn't have a ground, you need to stop using that equipment. Is the equipment near water? There are various procedures in the hospital that require water. In the ER, it could be a spilled IV fluid or blood, both of which are conductors, or it could be a chest tube thoracostomy and there's water, or there's urine on the floor, and so many other things. Is it under the carpet? It's at risk for electrical fires. And the circuits, are they overloaded? The circuits should close or should shut off if there's overloading. But then again, we're not sure if this is an old house, old facility, old building. It's more likely for it to burn. Again, three prong, pull by the plug. Do not pull by the cord, pull by the actual plug. All right. If there's an electrical current coming out from the plug, don't touch it. Let electrical people to do it. All right. Don't put yourself at risk as well. Don't operate if you don't know how to use an equipment. All right. Very clear about that. This is JCO and Medicare protocol that all equipment in the hospital should have a manual available for users, right? Whether it's a tech or a doctor or a provider or a nurse, right? So what they usually do, the hospitals, they attach those manuals on the equipment. All right, they're attached, so you can see the manual actually attached to the device. If you're not sure how to operate, call someone who knows how to do it before you get an electrical injury. And disconnect before cleaning. Some equipment can be cleaned, some cannot. Check your hospital policy. If you're about to clean it or disinfect it, please disconnect it first. Merely turning it off does not stop the electrical current, and we know that for sure. This is a select all the apply question in the past. In the NCLEX, it might still come out in your NCLEX because they are still using most of the question banks that have come out already for other students, all right? And radiation safety, all right? For radiation safety, it's one of my last two slides before the question and answer. All right. Remember the DST principle for radiation, particularly if this is a brachytherapy where we're putting radiation devices inside body cavities like radiation pin or radiation rods, right? So for vaginal cancers, for rectal cancers, for prostate cancers, doctors would put those oncologists would put those radioactive devices or metals inside the body. All right. So for example, it's a rod. Patients are getting brachytherapy or radiation through a rod, radioactive rod. Remember the DST principle. Distance is at least 6 feet. The closer you are, the more likely you are exposed to radiation. So we're not only protecting the patient, we are protecting ourselves too and the visitors. Distance should be 6 feet. Letter S is shield. Are you shielded? All right, there's two shields that we can use, all right? First one being the concrete wall. So those concrete walls inside that covers the patient is actually a protective device. All right, you need to keep these area closed at all times. If the door is open, radiation might leak out and cause problems to the people around. And wear lead apron. It's a heavy apron that we use. We put it there on your neck, on your chest, whatever highly active parts of your body, covering your groins and your legs, and then you can go closer to the patient. So you must wear the lead apron. So two things that can stop the radiation, the gamma rays, are the concrete at a certain thickness and lead. All right, I think it should be at least half or 1 inch thick. But use this when going inside a room. If you're an oncology nurse, it's not my specialty, but you need to remember this. It's an NCLEX question. Time. It's maximum for 30 minutes per shift. All right. When you are providing care for patients with radiation therapy, 30 minutes per shift only. So we must rotate nursing care and organized nursing care. Cluster caring is what we call it, like organized. Instead of coming there for 5 minutes and another 10 minutes and another 10 minutes, cluster the care. When you're inside the room, do everything, your vitals, your positioning, give the medications, ask the patients if they have more concerns, and then we can go out. All right. If dislodged, and question, do not touch the device or the source of radiation. All right, you must use long handled forceps and put it in lead lined container. All right. Lead container should be at the bedside with long forceps. If the brachytherapy source, the rod came out, pull it with a long forceps, put in the lead container, close it, and then report to the biomedical team. No pregnant women, no children below 16-year-old inside the room. All right, radiation affects the cells that are actively on mitosis. All right, so children have a lot of active cells because they're growing. All right, we're actively reproducing cells, and pregnant women have the fetus, and their fetus can absorb the radiation. Wear gloves for secretions. Some brachytherapy are medications that are swallowed or being drank. It's fluid, so it goes to the bodily fluids. All right, the bodily fluids are considered radioactive as well. So wear gloves for secretions. For patients that are using toilet and they have radioactive devices inside their body or brachytherapy, tell them to flush the toilet twice, at least twice, so no radioactive material is left in there. All right, in the water, flush twice at least. For healthcare providers, we need to wear a dosimeter badge. It's a badge that measures your radiation exposure. All right. Questions so far. Remember these tips. These are select all the apply question and prioritization question for the NCLEX. And the last one is for safety, for poison. I'm sorry. Most at risk for poison are children, toddlers, right, are most likely to have poisoning because toddlers are very independent. Remember, autonomy versus I forgot what it is, but it's a growth and development milestone. So they're being more autonomous. They're now able to walk and climb and go up the ladders and get something and open up those bottles and drink it. Toddlers, but of course, you also think about older adults if they're dementia and blind. If they're teenagers and this is poisoning, it's more likely like a suicide, all right, attempt. But look after toddlers because they don't know any better. They just know to be autonomous. Toddlers, they like to say no. If you tell them don't drink that, they're more likely to drink it. All right. Remove if the patient, if you see a patient that have probably drank something poisonous, remove any material from mouth and body. Wear gloves if you can. This is what we teach to patients, all right, not for nurses. If the family members can do it, identify the substance or bring these bottles or whatever objects that were probably close to the patient when they died of poisoning to the hospital so doctors can figure out what to do. Once they're inside the hospital, we provide the usual emergency care we call poison control center. um, that way we can, the poison control center have these manuals to tell us what to do. So we're going to tell them as much as we can, what substance would have probably been ingested, and they're going to look it up in their database and they're going to tell us, okay, do these labs, okay, do this EKG, monitor for increasing QTC or prolonged QTC, labs, electrolytes, give IV fluids, give, if it's acetaminophen overdose or Tylenol, then we give acetylcysteine, or we give other antidotes, which is, I'm not going to discuss it today. I usually discuss it in emergency care. And do not induce vomiting. Call 911, take the patient to the hospital. Do not induce vomiting. That's an old practice, evidence based. If you induce vomiting, patients more likely to it's more likely to cause aspiration and more complications. Say vomit if they vomited by themselves, and take to the hospitals so we can identify what chemical is that. All right. There is a question if the nurse should only handle one patient under radiation per shift. I'm not sure about the ratio for nurses for oncology. I believe it's 1 to 1 because of we need to limit the time allotted for them. Or if they have other patients, they should only have one radiation patient and the others should be non-radioactive if they have to do that. Right? Thank you. All right. Thank you for that question. And more students are coming in. And we have about 200 people now who's in the live class today, and more people are coming in. Now let's go to your questions. Are you guys ready? If you guys are ready for the questions, these are only 6 questions. We have a few minutes left for the live show. Please type yes, I can on the comments if you think you can challenge the questions that I'm going to post here. If you think you're ready for the questions and you're ready to challenge my questions, please type yes, I can on the comments so I can proceed. All right. Need coffee, guys. It's very early here. All right. People are getting ready. While I'm waiting for responses, if you're interested for a scholarship program from the Kinetics USA recruitment agency and Aspire RN NCLEX preparatory course or review class company, you can see the link at the bottom of your screen or in the comments section. Um, put this on your web browser, cusa.link/aspirern, and you can apply there, and we can connect you to our recruiters who will interview you and connect you to Kinetics USA that can provide a scholarship and Aspire RN to train you for the NCLEX, right? So it's a partnership with Aspire RN and Kinetics. It's a very good program. Kinetics has a lot of open spots for nurses around the United States. They do a lot of, free processing and stuff like that. Please apply on the link, and the recruiters are gonna get to you to explain the program. All right, it's also in the comments section. We are now ready to challenge the question. I've seen a lot of, yes, I can in the comments. All right, number one. A guardian comes to you to report a fire in one of the patient's rooms. Upon entering the room, you note that the patient is standing on the other side of the room with his clothing on fire. What is your first action? If the patient's actively burning, what is your first action? Is it grab the towel to smother the fire? Go find the nearest extinguisher? Call for help? You can do letter C, right? By the time you come back, patient's already dead from the fire. Do something. Or letter D, ask the patient to drop and roll. Letter C is an incorrect answer because you're leaving the patient alone. The patient's actually burning. The clothes as fire. So your choice is between B and D. If you leave the patient to get the fire extinguisher, patient will die. And tell the patient to answers letter D. Tell the patient to drop and roll right on the floor. Try to roll. That will extinguish the fire. Right? Drop and roll. All right. Do not touch the patient. Do not put a blanket. All right, or towel because it might cause more fire. All right. Do not try to sprinkle with water. It will not kill it. So tell the client to drop and roll on the floor. Very good. That's 1 point for you. We have 5 more questions. You have to tell me your score after this class, all right? Number two, a patient suddenly reported feeling a strong shock after turning on an electric hair dryer. What should be the priority action of the nurse to care for this patient? Disconnect the hair dryer from electrical outlet, assess the client's apical pulse, assess the client's radial pulse, assess the client's skin for signs of electrical burn. All right, let's see. More people are coming in. Our live stream numbers are coming up as we speak. Thank you for those who have joined. You can review the start of the recordings to review it from the start later after this class has concluded. So what's your answer? We have mixed answers here. Some people said A, some people said D. Um, any more answers? Any more dissenting opinion? Anyone answered B or C? There's one that said B. The rest are A and D. All right. All right. People are providing their answers. Answer, guys, is letter B. I'm sorry to pop your bubble, but only one person got it correctly out of hundreds. Why? Let me explain. I know you are confused why. All right, guys, if the hair dryer is electric, there's an electric current coming from the hair dryer, all right? Remember I told you do not touch it because you're also gonna have an electrical injury, all right? Do not touch it. I told you earlier, do not touch a live wire, and equipment that's damaged that could be electric, all right, or live electric current coming out from it. So do not do letter A. Letter D can wait. Answers letter B first. Electrical injuries can cause what? Cardiac rhythms, and it's our first priority. It can cause ventricular fibrillation or ventricular tachycardia because of the extra electrical impulses directed to the heart. So answers letter B. If it's letter A, we actually call the biomedical team to try to disconnect it. Of course, you tell the patient to drop the hair dryer first, and then you check the apical pulse. Do not try to disconnect. I've already told you about that. A lot of people said letter A. If you try to disconnect, you're going to get electrical injuries as well. So now there's two patients, your patient and yourself. All right, answers letter B. Check apical pulse. Electrical injuries can cause dysrhythmias to the heart, particularly ventricular fibrillation. Answers letter B. Number three, a community receives a call reporting accidental ingestion of 5 cc liquid dishwasher. Upon probing, the patient was said to be alert, conscious, not in distress. What is the next best thing to do? I'll let you read the options. We have another student who just joined, and he's from Kenya. It's 3:30 p.m. in Kenya right now. All right, I'm seeing a lot of answers now. Mm-hmm. Very good. I think we're getting the right answers on the comment section. Other people are probably waiting for other people to answer to copy their answers. I'm just kidding. But based off of this, and we've talked about it earlier, letter A is incorrect. All right. There's no reason to drink a lot of water. If you try to flush it out, how it cannot be flushed out. Letter A is wrong. Go to the patient's house and insert an NGT for what? Are you trying to suction it out? First of all, we don't try to suction it. Secondly, why would you insert an NGT in the house? Just bring it to the hospital. Answers letter C. So there's more people coming in actually, and I'm about to wrap up my class. I'm so sorry, guys. But again, after this class is concluded in about 10 minutes, you can review the live recording right away. So please keep sharing this link to your wall so more people can see it. Again, you can still watch it even days later. All right, we're going to be posting it in both Aspire RN Facebook page and Kinetics USA Nursing Facebook page. Answers letter C. Number four, this is a select all that apply. Question: a fire broke out in your institution as a nurse. Which among the following will be your role at this time? What would you do? This is select all that apply. This is your favorite type of question. All right, so let me see your answers. There are multiple answers, so don't give me one correct answer. There are multiple. Do you shut off medical gases? Do you use fire extinguisher? Do you direct ambulatory patients? Do you help evacuate patients? Do you carry patients out by yourself? What are the correct answers? So there's definitely more than one. I'm seeing answers now, but I want more answers before I give you the final answer. More people are coming into our live stream. Please follow our pages Aspire RN Kinetics USA because we're doing a lot of free classes And if you are not following our page, you will not get notified if we are putting up events or shows like this. If you follow our page, you're more likely to find out if we're doing free live classes. I do live classes as well for every now and then. So please make sure to follow our page. Our company names are at the bottom of your screen. It's Aspire RN Kinetics USA. Search the same name in your Facebook and you'll see our page, right? Answer is 1, 2, 3, and 4. We have shut off valves in the nurse's station or wherever it is located. What you do first is shut off those valves because oxygen flows in those tubes. In the OR, we have nitrogen and other volatile gases that can explode or can cause fire to like spread out, particularly oxygen. Oxygen is not combustible, but it's flammable, right? Um, it doesn't explode, but it spreads out the fire. Shut off the medical gases valve. There's a valve that you need to shut off. Part of your fire training in the hospital is you need to close that valve. Use fire extinguisher, of course. Direct ambulatory patients because you want them to evacuate. Help evacuate patients, but please do not carry the patient yourself. All right. You need to protect your back because you want to last long as a nurse. So protect that spinal cord and spinal column. All right. You do not carry patients. You're not a fireman. Leave it to the fire people. All right. Ambulatory patients get evacuated first. If they're non-ambulatory, well, if you can grab them through a mobility device, wheelchair, stretcher, take them out. If not, we cannot save them. All right. Let the firemen do it. I call 911. Of course, your team should call the fire people. All right. And question number 5, a nurse is caring for a client. We're going to extend for a few more minutes. Miss Milanis is our online moderator. I'm sorry, ma'am. We're going to extend for a few more minutes. I'm about to wrap up. A nurse is caring for a client with sealed radiation implant. It's an implanted radiation device. The following are nursing care for a sealed implant that dislodges, except what? Except what? More people are coming into our class. We're about to wrap up. Encourage the client to lie still, pick up the radioactive source immediately, deposit the radioactive source in a lead container, or contact the radiation oncologist. What is incorrect? That's the only question. Incorrect would be letter B. Very good. Do you pick it up, or what do you use to pick it up? What do you use to pick it up? You cannot pick it up with bare hands. All right. What do you use to pick it up? I mentioned earlier. Please type it. What do you use to pick it up? It's, what is that? Long forceps. Very good. Do not touch it with bare hand. It should be long forceps, not just a forceps. It should be long forceps, right? As far away from you as possible. So you have to use long forceps, right? Do not put it close to your body. You're going to absorb the radiation. Last number. It's a select all that apply again, your favorite. While visiting a patient at her home, the nurse acknowledges that the patient observes safety measures through the following statements. Except, I'll give you about a minute to read this because these are statements, so they're kind of long, right? And this is select all that apply. I cannot see number 6, but I probably can pull it out for you. 1 second. What's number 6? Let me open that file on my iPad right in front of me. But try reading it. It's a statement. And that's a select all that apply, which means you have multiple answers. I already mentioned that earlier, right? Thank you to those who have just joined. This is being recorded and we will post it in our pages so you can still watch it later. All right. So number 6 is actually, what slide number is this? 23. Right. Hold on. Number 6 is I had a generator installed in my basement to electricity in my house at all times. I had a generator installed in my basement to electricity in my house at all times. So what is your answer? Correct statement is what we're looking for. Letter A, I'm not able to reach the back burners of my stove, but I am fine just using the front burners. Um, Oh, we're talking about except. So we're looking for negative statements, because it's except. Letter A or number one is a correct statement. It's a positive statement. So that's not the answer. Number two, I do not like wet shoes. So I make sure there are rugs. Rugs and carpet increases the risk for slippage, increases the risk for fall. So two is part of the answer. We're talking about negative responses. Three, I almost fell going down the stairs, so I bought non-skid slippers. That's a correct statement. That's not part of the answer. Four, it is almost winter time, so I use my gas oven to warm up my home to save electricity. Do not do that. Carbon monoxide poisoning. I remember last year here in Texas, we had a freeze last year, February, and people started using stove because we didn't have electricity for a couple of days. And sure enough, the ER was flooded with patients with carbon monoxide poisoning. So please don't do that. It can cause carbon monoxide poisoning. So four is part of the answer. Five, I've installed emergency lights in my house so that I do not trip. That's a positive or correct answer. We are not looking for that. We're looking for negative statements. And six, I had the generator installed in my basement to electricity in my house at all times. If you put the generator, which is gas powered, in the basement, it will accumulate carbon monoxide. All right. You put the generator outside. If you put it in the basement or the garage, it will accumulate the carbon monoxide and it can cause carbon monoxide poisoning. And the only antidote for carbon monoxide poisoning, assuming they still they come to the ER or they arrived in the ER conscious, is high flow oxygenation. We use non breather to flush out their carbon monoxide, and we do blood tests every now and then. All right. So answers 2, 4, and 6. Can you put your scores at the bottom? Scores at the bottom. Can you put your scores in the comment section? Again, thank you guys for joining. I'm about to wrap up. If you are interested with a scholarship program hosted by Kinetics USA and Aspire RN, please click the link on the comments and on the screen. We will flash it. cusa.link/AspireRN. You will fill out the form and our recruiters will get a hold of you. Thank you for joining us. If your score is above 3, which is 3, 4, 5, 6, you have done very well. If your score is below 3, it is okay, which means you just have to study more about safety. Remember, this is 12% of your NCLEX. Now, if you're not interested in scholarship and you just want to join Aspire RN, we're giving 20% off and longer duration. We double the duration for our programs. We have 4 different programs, and it's flashed on the screen right now. You can also follow me on my social media, Facebook, Instagram, and TikTok at Dr. Nurse Paul for more information. These are our different programs. You can see in the screen our different subscription programs and different features. Our most popular is the SurePass Plus because it can you will have your own UWorld account for 90 days, and we will use that to evaluate you and monitor you as well. We have personal mentorships. You are assigned your personal student advisor, and so many great things that our Aspire RN students are enjoying. All right. And of course, if you want a crash course because you're about to take your NCLEX soon, we are doing HIT Final Coaching Class. HIT stands for High Impact Tutoring. So this is a question and answer live sessions. We're going to go through 1,000 questions in 10 days. And you also have access to our previous classes for 30 days to review our live classes. But then again, this is 10-day high impact question and answer course. And we've had a lot of students that join us in it and passed. It's pretty good. We've selected questions that are high impact that comes out in the NCLEX. These are our dates for the third quarter of the year, July 4 to 15, August 8 to 19. September 5 to 16. Regular price is $175, super cheap versus the quality that we provide. A lot of our instructors are US based, US experienced. So, very credible sources. A lot of our instructors, including myself, have graduate degrees, doctorates, and master's graduates. I carefully select our instructors to make sure that you guys get the best. And we are running 20% off for that as well. So that will be $145. You can enroll in my website, aspirern.com. But if you are interested with the scholarship program, again, let me plug again. The link for the scholarship program is at the bottom of the screen. cusa.link/ASPIRE bit.ly/AspireRN for Kinetics USA Scholarship, and they will direct you to Aspire RN. We hope to see you guys. And follow me on my social media at Dr. Nurse Paul on Facebook, Instagram, and TikTok. I'll be posting more updates for our upcoming classes. And Kinetics College, again, is hosting free classes for NCLEX and English exams every Monday. So tune in to our Facebook pages and we're going to announce it to you. Thank you guys for joining. Please share this on your pages so more people can watch it. They can still watch the show later after this class is concluded. If you have questions, you can send us a message on the comment section or comment on our Facebook pages or direct your question to me. We can help you out whichever way you try to contact us. Thank you guys, and you guys have a great day. We'll see you next time. Bye.